So typically when you have someone that has an issue, a disc issue that's causing symptoms, it's because either the inflammation is interfering with the nerve root, or there's actually something physically, like that disc bulge, putting pressure on the nerve. Now, there's different degrees of these injuries, obviously, but we're going to stick with more kind of like the mechanical disc bulge, like a disc is bulging, putting pressure onto a nerve root. Now, this is a soft tissue injury. So just like we said before, with the muscles, with the ligaments, as we look at a soft tissue injury like this, these do heal. And discs are vascularized, and they heal relatively well. I think that there's kind of this misconception that once you herniate a disc, it's always herniated. And if it's more of a chronic case and it calcifies and there's kind of more permanent changes, then yeah, it kind of is what it is structurally. But in someone that's young, someone that's healthy, someone that's active, you're probably going to have disc herniations. You probably honestly have them right now. And a lot of times they're asymptomatic, right? We can have these issues and they don't put pressure on a nerve. We never know that we had it, and it just kind of heals and it goes away on its own. The issue is when it does cause pain, because the type of pain that this will cause, it can be pretty debilitating. These are ones that are more nerve type or electrical sensations. Some of the symptoms, if it's up to a higher degree, are that you'll have muscle weakness in the nerve distribution of that nerve that is being impinged. And if it is worse, because of that muscle weakness, over time you can actually get muscular atrophy in the muscles that nerve distributes to. So these can be a bit more of a severe injury, because it's not just the area that's injured, it's actually affecting the whole nerve distribution, and not to mention like pain through that nerve distribution as well. So these are ones that people usually take a little bit more seriously, and they can have longer lasting consequences if they're not managed well. But it's the same process with these, managing these, as it is that we just walked through before for a strain, for a sprain. It just looks a little bit different, because the tissue damage is not necessarily the area in which we're having symptoms a lot of times, because you will get similar symptoms of the muscle guarding. Muscles will tighten up a lot in the low back. You get a lot of psoas tightness as well. The psoas attaches to the lumbar vertebra, so the nervous system will kind of use that to prevent movement through the lumbar spine. And a lot of the compensations are they're kind of more encompassing than a lot of times the locality of a muscle strain or sprain. So in my mind, that gives us greater opportunity to make someone comfortable without having to really do any axial loading or anything in the area of that injury itself. So like things that are going to be helpful in that kind of baseline process of, all right, what compensations are going to develop from this? We need to look at how they're moving through the hips, and that's going to be like psoas, like what's the tone of the psoas? Can they get through hip flexion and extension? A lot of times with disc injuries like this, you'll see either people have a flexion or extension bias, meaning that one of those directions, either flexing the lumbar spine or extending the lumbar spine, relieves symptoms. So that can be a really helpful piece of information, is that, all right, if you feel better in flexion, guess what? We're going to do all of our corrective exercises in lumbar flexion, or we're at least going to avoid lumbar extension. And that's going to be one of the last things that we'll test before we start to add in any sort of demand through lumbar extension. And then along with that, there's a lot of potential through releasing muscle tension through the lower body, through like rotation of the hips, like I said, flexion extension of the hips as well, to start to diminish the symptoms that someone's having. And a big thing, I didn't mention this with the first one we talked about, lumbar sprain or strain, but this holds true for both of those and for disc herniations. The biggest thing that you can do to help someone not have these injuries again is to help them build awareness around why this happened in the first place, right? The majority of both of these injuries that I see are from people that are probably not necessarily beginner athletes, but maybe like beginner to intermediate. They're kind of in that realm where they don't have a ton of awareness around how they're moving. They don't have the best technique, but they enjoy training. Maybe they've gotten into strength training and they're starting to build up a baseline of strength, but the way that they're loading isn't consistent with body mechanics. And a lot of times that comes down to them not understanding how to properly use their core to transfer force from the lower body to the upper, or the upper to the lower. So either of these injuries, that's going to be like buy-in baseline, is starting to build awareness around how to control the core, how to resist movement through all three planes, and then starting to continue to progress that stimulus and make it more dynamic over time as symptoms have reduced, as tissues have healed. So that's kind of the realm in which I'll start with managing people with disc herniation. Is first off, you need to find the ranges of motion that they're okay to move in. You need to find the ones that they're not okay to move in. You need to find the ranges of motion that they're restricted in from the injury, and then you just keep them in ranges of motion that don't increase symptoms, and you find exercises that they can do in those ranges of motion that will start to reduce the tension in the areas that they're restricted. Because that muscle guarding that's going to be their body saying, we're not going to move this way because we don't want to put any torque through the lumbar spine. Now, if we're increasing their ability to move freely and increasing their potential to create torque through the lumbar spine, the thing that we have to teach them, and this is very much teaching, is you need to teach them how to consciously and actively protect that lumbar spine through core bracing. One of the ones I found pretty successful, even with people that are in a pretty acute state with this, is if you have someone lie on their back and you can do like just knees bent. It's essentially like a McGill's curl up, right? Knees bent, feet on the floor. You're gonna have them do a curl up and kind of contract the abs. From there, you can progress that. You could go 90-90 with the legs. You can put their feet on the bench. And then from there, we're just going to continue to progress that stimulus, making that more and more demanding, getting them to understand how to create space through the back of the lumbar spine. That's where the nerves exit, right? So if we can flatten that lumbar spine, a lot of times that's going to give them relief from the symptoms. And just like we said with strain, sprain, probably 6 to 12 weeks of tissue healing time, because remember, herniated discs do heal, and they will heal if you let them, right? If you start loading too soon, you go back to normal activity without any sort of focused intervention, then yeah, you're probably gonna do the same shit again, and you might end up with a bad back. But if it's something where we're ramping up the intensity of what they're doing, as there is some sort of learning around how to control the lumbar spine, stabilize the lumbar spine, restriction in movement in the hips is always going to create more tension on the lumbar spine, right? So making sure that they're not restricted through the hips, increasing their stability in unilateral stance, their ability to create rotation through the hips, open and closed chain. All of these things are going to be strategies that take stress off of that lumbar spine. And as they learn how to do this more consciously, then that's going to allow them to move more freely with less stress on the lumbar spine. And as long as they're bracing their core, you can more evenly distribute that stress through the musculature. And that's going to be kind of the long-term key for managing disc herniations.